Okay, so which this gets us to a next extremely important part with respect to intestines, that is intestinal polyps. बहुत important है and repeatedly asked है intestinal polyps. So starting with intestinal polyps, I can divide intestinal polyps into two types. हम लोग intestinal polyps को दो types में divide कर सकते हैं. That is non-neoplastic polyps. I can divide intestinal polyps into two types: non-neoplastic, non-neoplastic and neoplastic polyps. दो type के non-neoplastic and neoplastic. Which are more common? More common क्या है? Non-neoplastic या neoplastic? Non-neoplastic polyps. Non-neoplastic polyps are more common. पहली चीज obviously benign है ना, non-neoplastic है, they are more common. They are more common. Next point, I can divide non-neoplastic polyps. So first we'll have a look at non-neoplastic polyps. I can divide non-neoplastic intestinal polyps into three types. That is inflammatory polyps. Non-neoplastic polyps तीन type के हैं. That is inflammatory polyps, hyperplastic polyps, inflammatory, hyperplastic polyps, and hematomatous polyps. Inflammatory, hyperplastic, and hematomatous polyps. So non-neoplastic polyps are of three types: inflammatory, hyperplastic, and hematomatous polyps. Starting with inflammatory polyps, पहले वाले से शुरू करते हैं. That is inflammatory polyps. Inflammatory polyps, they occur because of repeated cycles. They occur because of repeated cycles of injury and healing. They occur because of repeated cycles of injury and healing. देखो inflammatory polyp है ना, inflammation के कारण हो रहा है. It occurs because of repeated cycles of injury and healing. And the classical example of inflammatory polyp is solitary rectal ulcer syndrome. And the classical example is solitary rectal ulcer syndrome. The name tells you everything. There is a rectal ulcer. There is an ulcer in the rectum. There is a solitary rectal ulcer. As a result of which, it is clinically associated with solitary rectal ulcer में क्या होता है? Clinically, it is associated with rectal bleeding. Mucus discharge and inflammatory lesion. It is associated with rectal bleeding, mucus discharge, and inflammatory lesion on anterior rectal wall. Mucus discharge and inflammatory lesion and inflammation on anterior rectal wall. This is an inflammatory polyp. So the first non-neoplastic polyp is an inflammatory polyp. Inflammation के कारण हो रहा है ना. So this is occurring because of repeated cycles of injury and healing. Classical example of this is solitary rectal ulcer syndrome. Which is a clinical triad of rectal bleeding, mucus discharge. बहुत ही obvious है. Rectal bleeding, mucus discharge, and inflammation. Next point. Next non-neoplastic polyp is hyperplastic polyp. Next है hyperplastic polyp. Hyperplastic polyp. This occurs because of reduced epithelial cell turnover or increased epithelial cell turnover. This is one of the most common mistakes that students make in a live to live class, which is this occurs because of reduced epithelial cell turnover. This occurs because of reduced epithelial cell turnover, which in turn leads to the turnover is reduced, so it leads to piling up of absorptive cells. This in turn leads to piling up. This in turn leads to piling up of absorptive cells. The epithelial cell turnover is reduced epithelial cell turnover. The turnover is reduced, which in turn leads to, अगर turnover reduced है, so the absorptive cells keep on getting piled up, leading to the formation of hyperplastic polyp. Next point, both of these, inflammatory polyp and hyperplastic polyp, both of these, they are non-neoplastic in nature. They are non-neoplastic. So they do not increase the risk of malignancy. So they do not increase the risk. They do not increase the risk of malignancy. They are non-neoplastic polyps. They do not increase the risk of malignancy. पहले दोनों, inflammatory polyp as well as hyperplastic polyp, do not increase the risk of malignancy. Versus the